So you check integrity, expiration date, and color. Don't do it yet, just watch me. You peel it back like a banana, making sure you hold the peels back. The peels flip up as I'm pulling out, I can contaminate the sterile part of the syringe. I take it out. The sterile part of the syringe is right here. Does that make sense? So I've touched the syringe, but the part that I want to be sterile is still sterile. And then I'm going to open up my filter needle, which you guys will take a second to look at when we get to this point. But when you look in there, you can see there's a little silver or gray filter in there. That is also sterile. The two sterile parts go together. And I did not have gloves on, right? I did not wash my hands, and yet they're still sterile. So I just did a sterile procedure without washing my hands or wearing gloves. Is that okay? Yes, because the two sterile parts were never touched. Okay? Get to this point. Go. In your knowledge base right now, is there any time you would use an 18 gauge needle to inject?
No.
In your current knowledge base, there's not. When we do an IV, yes. But we're not doing IVs right now. We're doing sub-Qs or an IM, right? So is this needle for human injection? It is not. It is a filter needle with a filter on it, which is designed to filter out something. What do you think it's going to filter out? Glass. We don't want to inject glass into our patient, so we don't want to draw the glass up into here. We have to get the medication out of here somehow, right? So we're going to have to break this. Don't do that yet. Right? Watch, and then you guys will do. Because if you don't watch, you take your alcohol swabs, which you guys have. Don't get them yet, just watch. You peel it off, leave it like that. I'm just trying to protect my hand. It's going to go in here. I'm protecting my fingers. Does that make sense? And I'm going to take my two thumbs, and I'm literally going to do this. I'm going to push them away and pop it. Okay. Note. Being called surface tension is why water can go up your window and cause leaking, but it's also why this doesn't pour out. Cool magic trick. Who cares? No one really does, but everyone wants to see it. Okay, get to this point. Like you're seeing it and you still don't believe it. Okay, what we're going to do now is uncap our needle. Don't do it yet, watch. Everything we do, you're going to watch for so you don't hurt yourselves. This is what you guys want to do. This is wrong. This is you guys.
The rainbow.
Yes, because you want to do the small motion and you want to use precise pressure. I have no idea how much pressure this cap takes to remove. They're all different. So whenever I do it, and this is also wrong. This is you guys trying to do what I want you to do. This is you guys. Still not what I want. I want this. Big motion, don't hit each other in the head, but big motion so you don't. So get to the point where you have a needle in your hand like this. We're not mixing right now. Okay, so draw up 1 ml. Goes in, you just draw up to get your medication. You're going to see there's like an air bubble that occurs between your medication and your syringe. That's why I said go up to 1.5, 1.5. Now hold it right behind your back. You don't need it. As soon as you get once the needle is inside of it, you can then take your hand and grab it so you don't poke yourself. Always one-handed recaps and never after injection. Since we can't use this needle for the injection, guess what we have to do? Change the needle. So unscrew it, and where do the needles go? In the sharps. You're in a room with tons of supplies. You're the one that needs to know that I need a 22-gauge 1-inch needle because I'm doing an IM. Right now, the two of us have 25 gauges on. Can we give an IM right now? No, we cannot. We don't have the right equipment. No one picks the equipment for you. It is just in a bin with endless needles and endless syringes. You have to decide what you're going to do. 20-some years. My finger always hurts. It's not like I built up a callus underneath my nail. You must flick it as though Phil cheated on you. Right? And then you go up to the 1. And medication is going to leak out. Oh no. It's okay. It's not going to hurt you. Go up to the 1. And then everyone get to the 1 and let me see when you're at the 1. And I am. What degree angle?
45 and
90.
It's a range, but for 99% of IMs, what? 90 degrees for IMs. I walk into the patient's room. I identify the site. You're going to do this on your peer. I'm going to do it on Megan. You're not allergic to alcohol, are you?
Nope.
Okay. So I find her a Chromium process, right? How much medication do we have here? 1. Is it okay to give it into the deltoid? Yes. I could do any of them, right? 2-finger breast blow. Come and stand up so we can show them. I want your shoes. Here, slightly posterior. So I'm going to go right there, right? Do you guys agree? Take my alcohol swab and I clean for how long?
15 seconds.
I leave my alcohol swab on her like that. Why do I do that?
You know where it is.
So I know where I cleaned. It's like it's pointing. It's the little side of the square is pointing to where I cleaned. My gloves on. You could have your gloves on first if you wanted. It makes no difference. So we uncap our needles. Alright. Now I'm not actually going to uncap it because I don't want to accidentally poke her. So I'll leave my needle capped. You guys okay with that? I Z-track. Right? I insert the needle. Dart like fast. Students do this all the time. Dart like. That's going to hurt. Go fast. You don't have to worry about going too deep because you selected the right needle for the job. And when I say dart like, I've also had students actually throw it. Okay? So it's dart like, it's fast. Right? And then I let go. I inject my medication. And I pull it out. Okay, it's an IM. Can you massage? The literature is debating ISTO massage. Okay. After I go through that, I'm actually going to go over to the pillow that I gave you and sit down. Because I'll have an injection pillow of some sort. And do that, and you're actually going to take the needle off. You're going to Z-track. Dart like, what degree angle?
90.
All the way in. Okay? I would aspirate on an IM. Right, but if I find blood in my syringe right now, what do I do? Pull out, start over. No blood. I inject. I let go of the Z-track because it doesn't make a difference. I'll stop at the needle. As I pull my needle out, what happens? The layers of skin slide back to the regular spot, right? So slide, 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 slide. Now, what is the major concern at this point? Your patient is bleeding. Your patient has numbness. Your patient's screaming at you. Your patient's yelling at you. Do I care about any of that? Get away from me. I don't care about you right now because all I can do is hurt you more and hurt myself more. A lot of nurses want to take their thumb up by this. No, find a hard surface. Safety without your thumb ever being around it. Now I can address the needs of the patient. But when the needle comes out, all you should hear is safety, 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 safety the needle. When you take it out of your patient, safety, 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 safety the needle, safety the needle. All you can do is get hepatitis B, hepatitis C, HIV, safety the needle, safety, safety, safety the needle. When it comes out of the patient, you want to safety the needle. The patient's getting CPR. You're worried about them dying. Safety the freaking needle. Safety, 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 safety. There's no reason that a needle should ever not be safe as soon as you take it out of the patient. Safety, safety, safety. Another 30 seconds. Safety, safety, safety. What are you going to do when you take out the needle? You're going to safety the dang needle. Safety, 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 safety. I don't understand how students that I teach still don't safety their needles. Safety, 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 safety the needle. Jimmy, what are you going to do with it?
Safety the needle.
Safety the damn needle, right? Safety, safety. Nothing good can come out of it not having safety. 15 seconds of plank left. All right, good enough. Right? Guys, good, right? Go. An insulin syringe is for insulin only. There are no insulin syringes that have mLs marked on them. Now, they will tell you that 50 units equals an ml or 100 units equals an ml. They are unit syringes. You do not use any other syringe except for an insulin syringe for insulin. Does that make sense? You're at a nursing home, they have no insulin syringes. You have to give an insulin to your patient. What do? Have someone go to the pharmacy in town and pick up an insulin syringe. That's your only option. There are no other substitutes or alternative methods to do this. Right? You can't carry 6 tons of gravel in a car. Just can't do it. You need a truck. Right? Guys, I've seen 2 nurses kill people from this. Do they keep their license? Yes, they both got to keep their license. But how does your conscience feel the rest of your life? Because you were too much in a hurry to stop and think, am I using the right syringe? Is that important to me? Okay. Don't want to have any of you guys in the back of Momentum. Do you guys know what Momentum is? Momentum's the nursing journal that's published quarterly in the state of Ohio, and it tells all the nurses who've lost their license. It literally has all of your names, right? So if you have any type of restrictions on your license, your name will appear in Momentum until those restrictions are gone. Okay? What do you think we do as faculty? Every time the Momentum comes out, we go and look for our students. Right? I've seen like 15 of my students over time. That's a long list. It's like a list of like 200 every quarter of nurses. You know, whether they abused someone, they did assault, they are using illegal drugs, they committed a felony, whatever it is, they're on there. Okay? You guys good with that? Yes.
You're taking off the warning. You're taking off the.
You gotta hold this. Your insulin syringes. Megan, can I see it?
Yeah, but it's not safety.
Guys, when it slides up, that's not the safety because I can still poke myself because it'll slide back down. The safety is when you slide it up and you twist.
I can't take this off now, right?
You can. Cool.
So what I'm asking is how do you open the needle?
You hold onto the safety apparatus that slides up.
We did that the first time.
Okay, what we're gonna do now is mix insulins. And when we mix insulins, when we mix any medication, what's the first thing you want to do?
Check the order.
Well, you do want to, we have the
Oh,
three
sorry.
checks and the 6 checks which we've gone over. Doctor's orders, the allergies, the expiration date, right drug, right dose, right route, right patient, right time, right documentation. Good, I like that. Well, you're going to mix 2 medications. Before you even do that, what are you going to do? Do you ever mix Mr. Clean and bleach? Why not? They're not compatible. They will cause a gas which will cause you to pass out. It could kill you. Right? Same thing with medications. There's certain medications that are compatible together, and there's certain medications that are not. Certain medications, when you mix them together, they will have participant. They will form cloudy crystals. Right? Do you want to be giving crystals to your patient through their skin? No. So the first thing you do when you mix medications is check for compatibility. Are they compatible? Okay. For instance, MPH insulin and regular insulin are compatible. There's a medication called Lantus. Okay, Lantus, it's a long-acting medication, a long-acting insulin. It's not compatible with any insulin except for itself. So you have to do the Brittany here. The patient's ordered regular insulin and they're ordered Lantus, 2 different injection sites, 2 different needles. They're administered, they have to give regular and MPH. Now we can go in 1 syringe. Okay? Even though they're compatible, we still have to mix them in a certain order. And my little pneumatic, as you already said, Abby, it starts in the clouds and ends in the clouds. Starts in the clouds and ends in the clouds. So you want to get out your insulin syringe again. If you already used it, you have 5 of them. Not a big deal. Okay. You want to have both your regular and your MPH insulin and your alcohol swab. If you safety, get out a new one. You guys have 5 of them. Okay. You're going to take your alcohol swab and you can clean both vials using the same one. And how long do you clean each one? 15 seconds, guys. There should be a squeaking sound when you're scrubbing because you're forcing. You're trying to kill organisms. You're just recording me all day long. 15 seconds. All right, you're going to get 5 units of each. Someone tell me what I'm going to do next. I have my syringe and I've cleaned both of my vials. I start in the clouds. So what do I want to do with the clouds? Think through this, guys. I'm going to give 5 units of each.
5 units of each.
Okay, so what's the next thing I'm doing? Pull up how many mLs of air? 10. Okay, we could do that. So I'm going to give a total of 10. I can do it. No, it's fine. I'm going to uncap. Don't do it yet. Just watch. And I start in the clouds and end in the clouds, right? So where do I put the needle? Into the cloudy one. Okay, don't do it yet. How much air do I put into it? 5. So if you're going to do what Siri wanted you to do, you're going to put 5 units of air in there. Good. Come back out. Where do I go now? In the clear. I started in the clouds. I end in the clouds. 5 units into the clear. I then invert my vial, so I drop the medication. Can I drop more than 5 here? Sure I can. I have like 15 right now. What's the big deal? It's not because I'm not yet mixed. I go back up to my 5. Make sure I get out my bubbles, everything like that. Okay. Now I'm going to go back over to this one. Back to the cloudy one. My needle goes back in. I invert. Now do I have to drop precisely 10? Yes, I cannot drop 11 and I can't drop 9. If you drop 11, you try to push them back in. What are you pushing back into here? Regular insulin, which we're going to talk about peaks and stuff in a minute. Okay, I have to be precise with this one when I'm mixing, because now I'm mixing. So I have to go to precisely 10. When I'm at 10, take it out, behind your back, one-handed recap. Get to that point. Maybe you forget that. How would you know? Look at the packaging of your insulin syringe. What does it tell you on it? 1 ml max, right? And what gauge? 29 gauge. Do you guys know that 29 gauges are used for? Sub-Qs. Right? No insulin syringe will ever be bigger than a 25 gauge. Because they're all for sub-Qs. Okay? Now when you give a sub-Q, it's almost the same procedure. Jimmy, can we use you?
Mm-hmm.
Are you going to follow us over?
Yeah, where are you going?
I don't know. To the table that you're not on. Lay down. You might pull up your shirt. Is that okay? Come down back. Lay down.
Oh,
Can you
yes.
recap it?
Yes.
Maybe?
Well, which one? Is that it? Okay.
Thank you. We don't actually poke Jimmy. I gotta do, Jimmy's skinny, he's a runner. But can I pinch an inch? Good to go. How far away from the umbilicus?
1 to 2 inches.
Clean with alcohol. 15 seconds. I leave it pointing to where I cleaned. Again, you can have your gloves on already. It's up to you. What do I do with my medication?
It's right on the other side. Right here.
Oh, thanks. I would uncap the needle. I'm not going to do that. With Jimmy, with the sub-Qs, we don't do Z-Trax. Z-Trax for IM. I pinch. Put my wrist in contact. Right? A lot of students right here want to let go of that pinch. If you let go of the pinch, guess what happens? The needle comes back out because the skin fell away. Gotta hold it. Inject. Okay, pull out. And when you pull out, it's the first thing you do. Safety, safety. Do never recap it.
Not cap, I meant safety.
Safety the needle. You guys good with that? All right, practice. All right, I only have to give one medication to give this example, so I'm going to give Colace. Anybody know what Colace is for?
Stool softener?
It's a stool softener. All right. So we're going to imagine this little piece of paper that I have here is my MAR. On here, I'm going to check my doctor's orders. I'm going to check my allergies. I'm going to check my expiration date. Colace, doctor's order, patient not allergic to it, it's 100 milligrams. Okay, no allergies. Right drug, Colace, right dose, 100 milligrams. Right drug, right dose, right route. It's oral, it's a pill, makes sense. Right patient, we're going to give it to Jimmy. Okay, I'm going to go into his room. Right time, it's due at noon, so we're half an hour, so we're good. And I'm going to document when I'm done. If I had a second medication, I would put that one there, and I would draw out my second medication, metformin perhaps. Okay, that's an anti-diabetic medication. Doctor's orders, allergies, expiration date, right drug, right dose, right route, right patient, right time, right documentation. I put them there in a pile. Once they're all in a pile, I could have 20 medications, guys. That's not unrealistic. That's 100% gonna happen to you. You grab each one again, and you go doctor's orders, allergies, expiration date, right drug, right dose, right route, right patient, right time, right documentation. You take it, and you put it into the cup. Do it again. Doctor's orders, allergies, expiration date, right drug, right dose, right route, right patient, right time, right documentation. Once you have all your meds in your cup, you guys okay so far? I walk into Jimmy's room. Knock, knock. Hi, Jimmy. How are you?
Good.
Wash my hands. I'm here with your morning meds or your afternoon meds.
About
Okay.
time.
I have. That's what happens. I have Colace stool softener. You've been having a hard time moving your bowels, and I have your metformin for your type 2 diabetes. Guys, if they're getting a medication for diabetes, they have type 2. If they're getting an oral medication, it's type 2. If they're getting insulin, it might be type 1 or type 2 progressive type 1. You have any questions about either one of these?
Nope.
I open up his computer, I barcode scan them, ask him his name and his birth date, and then again with the MAR, it'll be on a computer screen. Doctor's orders, allergies, expiration date, right drug, right dose, right route, right patient, right time, right documentation. Does that make sense? Okay. Any questions?
No?
Here you go. You have directions on the card.
Awesome. So then you go through and...
No.
What's that?
What are
Oh,
your...
what I'm supposed to do?
Can you...
No!
James, what is wrong?
I'm angry.
I understand that. Okay, guys, how are you gonna handle this? Patient throws their medications. So Emily's jumping. They refuse. I'm done dealing with him.
You want to talk about what's wrong?
Try to de-escalate the situation. James, what's upsetting you?
I didn't sleep.
You didn't sleep. Do you maybe perhaps we can call the doctor and get a hypnotic tonight or something to help you sleep? Ambien or something? Would that be beneficial?
That'd be great.
If I did that, would you be willing to take your meds?
Sure.
Okay. Now they're in the package, right? Can I still use them? Yes, they're in the package. I can still use them. Let's say that I had opened them up because he doesn't have good dexterity. A lot of nurses will open up the meds. That's fine. I open up most of my meds for my patients. Right? If he throws them on the floor and they're open, can I use them? Where do I dispose of them at?
Sharps container.
Not sharps. That's the natural response, sharps. But if it's a narcotic, patients will dig into the sharps to get it out. In the med room, there's a special container. You go back and do not flush them. My kids do not want you ruining my waterways. Right? Allison doesn't want to grow up with toxins in the water. There's actually noticeable levels of digoxin in the water now. Like in your drinking water, because people dispose of medications and it goes in a special container in the med room.
I
Stephanie.
have a question. So when you take it out from the whatever, the cabinet first, and then you put it on the table, and then you check them again, and then you put them in the cup.
Yep.
So if you have like 20 medications,
I'll need 3-4 cups.
So how do you not like, because you're checking the dosage, the drug, whatever, how do you not confuse, because obviously some medications look similar, don't they? So how do you
They're
not
still all in the
confuse?
package.
So you don't take them out of the package?
I don't think I'm on the package. I would either hand them to Jimmy if he has good dexterity, he can open them, but most of my patients, I go through my 3 MAR checks, I'm done. That's why I don't check them. And that's why I explain with Eric, because he says, Tim, I don't want my Colace. I can still give him his metformin. But if I have them all in the cup and he says, I don't want my Colace, I'm like, and you'll see nurses will get out their little physician desk reference for their drugs or the drug book, and they'll have pictures of the medication, and they're comparing. I'm like, that is just not safe.
So do they all come in a package?
They all come individually packaged.
Okay.
Yeah, they all come exactly like this. And guys, it's 100% okay to do this with these meds. Push through the foil. You can touch the medication. It's not sterile. Someone touched this hamburger to prepare it for dinner, for lunch. Okay? Does that make sense?
Yeah.
All right, so the scenario just continues. Who else has a card? Devin, you have a card?